Good afternoon and welcome to the COVID-19 update on Channels Television. I'm Millicent Nwaka. First, some of the highlights. Today, Delta State Governor's family self-isolates after a child tests positive for COVID-19. More health workers contract COVID-19 in Enugu State, 72 in number, as total active cases rise to 160. And the United States halt reopening as the number of new U.S. infections rise and levels not seen since April. Texas and Florida among states to pause reopening plans. The Nigeria Center for Disease Control, NCDC, recorded 594 new cases of COVID-19 spread across 22 states, including the Federal Capital Territory. Of the new cases, Lagos has 159, Delta 106, Ondo 44, the FCT and Edo 34 each, Oyo and Kaduna 33 each, Enugu 28, Katsina 25, Imo 22, Adamawa 15, Ogun 12, Osun 11, Abia 8, Rivers 6, Nasarawa, Bauchi and Niger 5 each, Kebbi 4, Ekiti 3, 1 each in Plateau and Taraba State. Total confirmed cases now stands at 22,614, with 7,822 recoveries, and the death toll put at 549. Nigeria has a total of 14,243 active cases in the country. So far, the top 5 states with the highest confirmed cases are Lagos, the FCT, Kano, Oyo, and Rivers State. A breakdown of the highest cases in each of these 6 zones you can see showing there has Lagos, the FCT and Kano. All 3 are leading in their respective regions, the Southwest, North Central and Northwest respectively. Rivers State also tops in the South-South with 936 cases, Bauchi in the Northeast with 493 cases, while Abia State leads in the Southeast with 288 cases. The Delta State Governor Ifeanyi Okowa and his family have gone into self-isolation. This is after one of his children tests positive to COVID-19. Today, the Chief Press Secretary to the Governor, Mr. Olisa Ifejika in Asaba, said consequently the Governor and his family members will immediately commence self-isolation for 14 days. He further added that it is again important to stress that COVID-19 is real and citizens are advised to be disciplined and comply with the protocols of wearing face masks, maintaining physical distancing while in public places and other prevention guidelines. He says this is as the Delta State government intensifies efforts to stemming the spread of coronavirus in the country. Now, in Enugu State, the number of health workers that have been diagnosed with COVID-19 has risen to 72. This was confirmed by the Enugu State Ministry of Health in its latest update on the fight against the disease in the state. The state now has a total 202 confirmed cases of COVID-19, with 154 patients still on treatment, 43 treated and discharged, and 5 deaths recorded. The ministry asked residents in the state to continue to adhere to the guidelines, and this is to keep themselves safe from the virus. While in Lagos, it's discharged 36 more COVID-19 patients. This is according to the incident commander and governor of Lagos State, Mr. Babajide Sanwo-Olu. 25 of the discharged patients are male, while 11 are female. 9 of them were treated and discharged from Oniko Isolation Center, 8 from Gwagada, 7 from Agidingbi, 4 from Etiosa, and 8 from Lekki Isolation Centers after fully recovering and testing negative to the virus. With this, the number of confirmed COVID-19 cases that have been successfully managed and discharged in Lagos has risen to 1,475. And 167 Nigerians stranded in South Africa by the coronavirus lockdown arrived home on a flight from Johannesburg. According to reports, the evacuees all tested negative before being evacuated. They are to proceed on the 14-day self-isolation as mandated by the NCDC, the Ministry of Health, and the Presidential Task Force on COVID-19. The video you see is trending online, and the protesters are said to be some Nigerians who are angry over their alleged neglect by embassy authorities in Indonesia. What is worrisome is that the protesters are not observing any guidelines whatsoever at a time where the coronavirus is ravaging the world. Indonesia has the highest number of reported infections in Southeast Asia, surpassing 50,000, while at least 2,573 people have died, according to official data, the highest COVID-19 death toll in East Asia outside China. Now, the placard-carrying protesters claim that the country, Nigeria, is not helping them and, quote, "We don't have an embassy in Indonesia." Reacting to this, the Minister of Foreign Affairs, Mr. Geoffrey Onyeama, condemned the attack on the Nigerian embassy in Indonesia, describing the protesters as hooligans in a series of tweets on his handle. He said there is no justification for the attack. Part of the tweet reads that absolutely deplorable, disgraceful criminal behavior by Nigerian hooligans who, without justification, attacked the Nigerian embassy in Jakarta, Indonesia.
The Nigerians cannot do anything. They cannot help us in this country.
Joining us via telephone is Nigerians in Diaspora Commission. That's NIDCOM Chairman, Mrs. Abike Dabiri Erewa. Well, I'd like to thank you for joining us on the program.
Thank you. Good afternoon.
First, I'd like to begin with that video, which appears to be from Indonesia. Is it confirmed that Nigeria's embassy, that is Nigeria's embassy in Jakarta, and that the protesters are Nigerians?
Well, it has to do with the mission, so I'm sure the Minister of Foreign Affairs will address the issue appropriately. The Minister is on that particular issue. I only just saw it on social media, but the Minister will handle the issue of the mission appropriately because all those issues are under the Minister of Foreign Affairs directly.
Said a number of things relating to that and saying that every effort will be made to identify who they are and that they will be severely punished. But I'd like to ask you, as a chairman of NIDCOM, if you've before today gotten fillers as to the treatment of Nigerians in Indonesia.
No, none at all. That's why that video was a surprise. There was no, if complaints came from Nigerians in Indonesia to the NIDCOM, of course, we'll tackle it both. But maybe they've had issues with the mission and we're talking to the minister. I don't know. But all I know is that in Indonesia, we have quite a number of people in prison for drugs. And, you know, in Indonesia, penalty for drugs is death. So that's the case we're dealing with, appealing to them not to kill them, but they said that is their law. So there hasn't been any particular contact with the Nigerian Diaspora Commission about problems in Indonesia. So the one or two we received had to do with drugs, that, you know, they shouldn't let them be killed. But Indonesia says that is our law. We kill drug traffickers depending on the quantity of drugs. So it come out. But I'm sure the Minister of Foreign Affairs will be on the matter. Maybe there have been issues with the mission, and I'm sure, like the Minister said, he will ensure they're all punished and dealt with. And that is not the way to behave anyway, no matter what.
Perhaps as well, seeing as the world is battling a pandemic, how much more are you getting in terms of how Nigerians are being treated in diaspora? And this is following all the measures that different governments are taking to curb the spread of COVID-19.
Yeah, we're in touch with Nigerians in diaspora in various parts of the world. You know, it's something that's ravaging the whole world, so no country is left out. But the key thing is for Nigerians in the diaspora to follow the rules as stipulated by the countries they're living in. And then Nigerians in the diaspora are coming together to respond to help frontline workers in Nigeria. And very soon, this initiative by Nigerians in the diaspora will be presented to the PTF. And I think that is very impressive, that despite what they're going through, they're raising funds to support frontline workers here in Nigeria. That is very impressive. So, COVID-19 era, the key thing is obey the laws of the country, obey the rules and regulations put together. And our medical doctors, too, are doing online programs with their fellow doctors here. They share cases. It's not something you will see publicly, but they do share cases, share notes, and talk to one another on ways forward. So I'm impressed with what Nigerians in diaspora are doing. But the key thing is this is something ravaging the whole world. So we follow the rules and regulations as to the country where we're living. We've lost quite a number. We've lost almost about 40 Nigerians to COVID-19 in the diaspora.
All right, that's really a very sad thing. But to quickly get your thoughts, South Africans came in, that's Nigerians living in South Africa, just yesterday. And we hope to see more Nigerians who are stranded in different parts of the world in the evacuation process.
Oh, yes, absolutely. As I speak with you, we're expecting about 18 from France. And the France case is a chartered plane arranged by the mission through Total. And that will be the first time that, apart from those from Lebanon, who supported us, where they're actually be coming in without paying anything. So thanks to Mrs. Modupe Rele, our ambassador in France, about 18 passengers from Europe, some from Netherlands, Germany, Spain, got together. So she got them a plane through Total, and they'll be coming in later today, not paying anything. That, I think, is most commendable on her part.
All right, we'd like to appreciate your time, Mrs. Abike Dabiri-Erewa, NEDCOM Chairman. Thank you for joining us. Well, let's go over to Imo State, where our correspondent Ito Kwekute brings us this update.
Over 1,400 COVID-19 tests has been carried out by the Imo State government. This is according to the chairman of the COVID-19 task force in Imo State, Professor Maurice Iwu. He disclosed it at an enlarged security meeting with head of security agencies in Imo State when they met to discuss the enforcement strategy on the guidelines and protocols put in place by the state government to contain the spread of the virus. Professor Iwu also disclosed that the major challenge against the fight of the pandemic is community transmission.
The cumulative laboratory samples that our state has done is 1,461, which is about one of the highest in the country in terms of states that are testing, and it's definitely the highest in our zone. During our meeting this afternoon, we reviewed the level of compliance, and we have agreed that we form 4 teams that will be going around the state to ensure enforcement, both from the transport sector to the hotels to the markets. Each of these areas will be headed by the commissioner in charge of those ministries. Again, this is not the time for stories. As I keep warning and cautioning, certain things are above politics. We are talking about our lives here. And I want all Imo lives to work together, support our healthcare workers who are on the front line, and then see how we can get out of this pandemic together.
Only yesterday, the state recorded 22 new cases, which brings the total of COVID-19 cases in Imo State to 269. From Owerri, the Imo State capital, Ito Kwekute for COVID-19 updates.
Now, over in Europe, the World Health Organization is reporting a spike in more cases following lockdown restrictions. How is Germany affected? Deutsche Welle reports that in northwestern Germany, the total number of people infected with coronavirus at a slaughterhouse has risen to 1,500. The entire region where the slaughterhouse is located has now been forced to lock down by the authorities. We have DW correspondent Daniel Winter, and he's joining us on the program from Berlin. Daniel, why has this outbreak been so severe?
Well, I mean, it's a massive scandal that's rocked the country, which had so far been an exemplary way of dealing with the crisis. It's got an exemplary record. But one key factor was the working conditions. I mean, workers were standing almost shoulder to shoulder for hours on end, so no social distancing there. And then, the 6,000 to 7,000 workers, many of those lived in poor working conditions as well, with 14 people to a single apartment. So the air conditioning system seems to be part of a problem in the plant itself. With no filter there, it just worked as a catalyst for the virus. Now, the outbreak was so bad that the German districts of Gütersloh and Warendorf are now in total lockdown. That's 600,000 people, all due to this one particular outbreak.
What did the owner of the slaughterhouse have to say?
Well, the meat baron Clemens Tönnies says that he accepts full responsibility for what happened and has apologised, but he also said that it was an existential crisis for the company and still has refused to step down despite that. Now, the next big question on the mind of Clemens Tönnies will be whether the North Rhine-Westphalian state government will bring criminal charges against his company. That is something that the state government there is still making inquiries about. But make no mistake, this is a company which has billions of euros in turnover, so that makes the working conditions for the mostly Eastern European workers at the Tönnies meat processing plant particularly egregious.
But how about the response of the workers there? I'm sure the process of tracing, isolating and treatment has begun for them and perhaps their families as well.
Yes, well, we spoke to one of the workers who said that they heard their colleagues crying themselves to sleep at night. And, you know, a big problem for them with their working conditions is that they will be planned in for 8 hours and then they'd end up working 13 without the extra pay. Now, of course, all of these people, in fact, all of the workers who have not been tested so far are also being tested to make sure that they don't spread the virus further. But with 600,000 people in lockdown in Gütersloh and Warendorf, the authorities really are trying to do whatever they can to make sure that the virus doesn't spread further. It all comes down to this, though. Germany has been praised for its swift response and its low death toll. But it just goes to show with incidents like this that if Germany doesn't address its social blind spots, then the country will not be immune to a second deadly wave of the coronavirus.
Indeed, we do appreciate your time. DW correspondent Daniel Winter joining us from Berlin. Thank you. A number of states in the US are stopping their plan to reopen their economies and allow business open up. This is due to a spike in cases and hospitalization surge. This week, health officials estimated that at least 20 million people in the US may already have been infected with COVID-19. As the Centers for Disease Control, CDC, says the true number of cases is likely to be 10 times higher than the reported figure. Here's more on our global update.
U.S. states are halting reopenings as new cases soar. Texas, New Mexico, Arizona and Florida pause their lockdown easings amid a spike in new infections. In Texas, which has been at the forefront of efforts to reopen devastated economies shut down in the face of the coronavirus pandemic, has seen one of the biggest jumps in new cases, reporting over 6,000 in a single day on Monday.
If you do not need to go out and go to work or have to go to the store or engage in some other activity, the best thing that you can do is to just stay at home.
Paris-Orly Airport in France has resumed commercial flight operations after 3 months of shutdown due to the coronavirus pandemic. Fire brigade services marked the day, honoring the Paris-Porto flight that was the first to take off at 6 a.m. Passengers can no longer enter the terminals with non-flying companions, and wearing masks is required. Meanwhile, tensions remain high in Italy as army was deployed to the small town of Mondragon after some 49 people tested positive in a residential complex. Soldiers stood at barricades and police checks were in place around the housing complex, which lies northwest of Naples. And despite an outbreak of coronavirus in one state, Australia's Prime Minister Scott Morrison says they will continue easing social distancing restrictions.
Challenges in Victoria at the moment.
The country's second most populated state, Victoria, has seen 10 straight days of double-digit new cases. It has about 200 of the country's total of 270 active cases.
According to the NCDC, face shields without the face mask are not effective in COVID-19 prevention. They say the face shield is not a fashion accessory and must be combined with a mask to provide significant protection. You can find more on their website, regular updates on COVID-19 regulations and guidelines. From the World Health Organization website, your questions are answered on the coronavirus disease situation with the latest global numbers by country of COVID-19 cases on a daily basis. They have an update later today at 3 p.m. GMT as they keep up with strategies and plans to curbing the spread of COVID-19. Our website, channelstv.com, has the latest news. All you need to do is log on, access news in health, politics, business, sports from Africa and around the world. channelstv.com. And that's the COVID-19 update. Thank you for watching. I'm Millicent Wonwaka. Stay safe.